I threw 5 pills in the trash, not by accident, not out of confusion. It was a deliberate, informed decision. And I'm going to tell you exactly which pills they were and why I did it, because there's a very real chance that some of these same medications are sitting in your home right now. I'm Dr. Jake Taylor, and what I'm about to share isn't a lecture. It's the same conversation I've had with my own family members, people I love, people whose health I am personally invested in protecting. It is not a comfortable conversation, but it is a necessary one. Every week in my practice, I see the consequences of what I call the silent epidemic of older adults, polypharmacy. That's the medical term for taking multiple medications simultaneously, which becomes increasingly common after 60. And many of the drugs that people take faithfully every single day, medications for pain, for sleep, for anxiety, for allergies, are quietly waging war against the very organ they were never meant to harm, the heart. I want to be very clear about something before we go any further. Nothing I share today is a reason to stop taking your medication. Do not stop, reduce, or adjust any prescription drug on your own based on this video. Stopping certain medications abruptly can be dangerous, sometimes more dangerous than continuing them. What this video is for is to give you the knowledge to walk into your doctor's office and have a real informed conversation about what's in your medicine cabinet and whether it's truly protecting you. If you're over 60 or if you love someone who is, stay with me. We're going to open that medicine cabinet together. Write your country in the comments. And if you're new here, subscribe and turn on notifications. I make these videos every week for people who want real information about their health, not reassurance. Let me tell you about Harold. He was 71 when his daughter brought him in to see me. He'd been managing high blood pressure for 8 years, and his cardiologist was satisfied with his numbers, but Harold felt terrible, dizzy in the mornings, mentally foggy, exhausted by early afternoon. He'd stopped driving because he didn't trust his reaction time. He'd stopped going to his weekly card game because he couldn't concentrate. Everyone says my labs look fine, he told me, but I don't feel fine. I feel like I'm disappearing. We went through everything Harold was taking. Blood pressure medication, a sleep aid he'd been using for 3 years, an anti-inflammatory for his knee, an antihistamine he bought over the counter for seasonal allergies, and an older antidepressant his previous doctor had prescribed for nerve pain. 5 medications, each one prescribed or purchased for a legitimate reason, each one, in isolation, considered safe. Together, they were slowly dismantling Harold's quality of life and placing unnecessary strain on the heart his cardiologist believed was being well managed. Today, I'm going to tell you about 5 categories of pills that are among the most common in households over 60 and why every single one of them deserves a careful, honest conversation with your doctor. The first pill, common painkillers that pressure your heart. The first category is one I can almost guarantee is somewhere in your home right now. Anti-inflammatory pain medications, the kind people reach for without a second thought. Ibuprofen, naproxen, diclofenac, sold under dozens of brand names, available without a prescription, and so familiar they feel harmless. They are not harmless, not for a heart that has been beating for 60 years or more. Here's what happens when you take one of these medications. Your arteries, like everything else in your body, change with age. They become stiffer, less flexible. Blood pressure rises. That's simply biology. Now add a medication that blocks the compounds your body uses to keep blood vessels dilated while simultaneously telling your kidneys to retain more salt and water. The result is a double hit. Your blood vessels narrow, fluid volume increases. Your heart has to work significantly harder to push more blood through tighter passages. One pill occasionally may not move the needle much, but for the person who takes ibuprofen daily for arthritis, that extra workload is constant, day after day, week after week. A chronically overworked heart weakens. Research has shown that regular use of these medications meaningfully increases the risk of heart failure, heart attack, and stroke, particularly in people over 60. George was 72 and had been managing arthritis in both knees for years. He took ibuprofen almost every day, sometimes twice. "It's just one pill," he would tell his wife. During one of his visits, we measured his blood pressure before and 2 hours after taking his usual dose. It had risen nearly 15 points. That's what one pill does to your heart every single day, I told him. The alternatives are real and effective. Acetaminophen is far gentler on the heart for mild to moderate pain. Topical anti-inflammatory gels applied directly to the affected joint provide local relief without the same systemic risk. For chronic conditions like arthritis, physical therapy, gentle movement, and swimming address the underlying problem rather than masking it. Anti-inflammatory foods, omega-3 rich fish, turmeric, ginger provide meaningful support over time without touching your cardiovascular system. If you genuinely need an anti-inflammatory medication, the guidance is clear. The lowest dose that provides relief for the shortest time possible, and never without a conversation with your doctor about the long-term plan. The second pill, sleep and anxiety medications that raise your fall risk. The second category is one that people find surprisingly difficult to discuss because the relief these medications provide feels so necessary. Benzodiazepines, alprazolam, lorazepam, diazepam, clonazepam. Prescribed for anxiety, for sleep, for muscle tension. They work. That's not in question. The question is what else they're doing. For an older adult, the danger of these medications isn't primarily direct cardiac, it's indirect, and it can be just as devastating. These medications slow reaction time, they impair balance, they cause muscle weakness. In a person in their 30s, a little grogginess is manageable. In a person of 70 or 75, whose balance is already less reliable and whose bones are less forgiving, these effects are the setup for a fall. And a fall in an older adult is not a minor event. A hip fracture requires major surgery. That surgery means anesthesia, hospitalization, immobility. Immobility means blood clots, pneumonia, and enormous cardiovascular strain. Many older adults who enter the hospital for a hip fracture never fully recover. The chain of events that ends there often begins with a sleep medication taken in the middle of the night. Beyond falls, long-term benzodiazepine use has been associated with cognitive decline. Memory problems, difficulty concentrating, mental fogginess that families often mistake for the early stages of dementia. Patricia was 77 when I first saw her. Her family had become genuinely worried about her memory over the past 2 years. She was slower to find words. She repeated herself. She'd stopped reading, a lifelong habit, because she said the words wouldn't stick. She'd been taking a benzodiazepine for sleep for 11 years. We worked with her prescribing physician on a very slow, carefully supervised taper. It took months, but at her 6-month follow-up, her daughter pulled me aside after the appointment. "She's back," she said quietly. "She's doing the crossword again. She remembers things. Whatever happened, she's back." It was not dementia. It was 11 years of a medication that had been quietly dimming the lights. Cognitive behavioral therapy for insomnia is the most effective long-term treatment for sleep problems and produces results that no pill can match. Sleep hygiene, consistent schedules, dark quiet rooms, no screens before bed, morning light exposure, and gentle daily exercise address the root causes. If anxiety is significant, there are modern medications far safer for older adults than benzodiazepines. If you currently take one of these medications, never stop abruptly. That can be dangerous. Have the conversation with your doctor about a gradual, supervised plan. The third pill, an older antidepressant that disrupts your heart's rhythm. The third pill surprises people because it's often not being taken for depression at all. Older tricyclic antidepressants, particularly amitriptyline, are frequently prescribed for nerve pain, for diabetic neuropathy, for migraine prevention. They're effective at those things, but their effect on the aging heart is something every patient deserves to understand clearly. Think of your heart's electrical system as a perfectly timed orchestra. Every beat follows a precise sequence of electrical signals. There's a specific interval, called the QT interval, that represents the time your heart takes to recharge between beats. Amitriptyline interferes with this process. it can lengthen that interval. In a younger heart with strong reserves, that disruption may cause no obvious problem. In a heart over 60, which may already have some degree of electrical irregularity, a prolonged QT interval can trigger a serious arrhythmia, one that causes fainting, one that, in the wrong circumstances, can be fatal. Beyond the heart, amitriptyline causes dizziness, blurred vision, and drops in blood pressure when standing, all of which, as we've already discussed, point directly toward fall risk. Robert was 68, diabetic, and had been prescribed amitriptyline 2 weeks earlier for nerve pain in his feet. He came to the emergency department with palpitations and near fainting. His electrocardiogram showed a dangerously prolonged QT interval. We admitted him, stopped the medication immediately, and he recovered. The pill helping his feet had nearly cost him his life through its effect on his heart. Modern medicine has better options. For nerve pain, gabapentin and pregabalin address the same symptoms without the cardiac risk. For depression and anxiety in older adults, modern antidepressants are designed to be far safer for the cardiovascular system. For migraines, neurologists now have multiple targeted options. If you're currently taking amitriptyline, especially if you experience palpitations or dizziness, bring it up with your doctor at your next appointment and ask whether a safer alternative exists for your specific situation. The fourth pill, the allergy medication, fogging your brain. The fourth category is one that people almost never consider a risk because it's sold without a prescription. It's been around for decades, and it's marketed as something you take when you feel miserable and want to feel better. First-generation antihistamines, diphenhydramine, the active ingredient in many allergy medications and virtually all over-the-counter sleep aids, dimenhydrinate, found in motion sickness products. These medications work. They dry up congestion, relieve itching, and yes, they make you sleep. That sleepiness is the problem. These antihistamines are strongly anticholinergic, meaning they block acetylcholine, a neurotransmitter that plays a critical role in memory, concentration, and heart rate regulation. When you block acetylcholine in an older brain, the results are confusion, sedation, blurred vision, and difficulty processing information. In a younger person, these effects are temporary and manageable. In a person over 65, they substantially increase fall risk, and they place unnecessary stress on a heart whose rate regulation is now being chemically interfered with. Long-term regular use of anticholinergic medications has been associated in research with accelerated cognitive decline. Dorothy was 80. Her family had been worried about her for a year and a half, watching her become more confused, more forgetful, less herself. A thorough review of everything she was taking revealed that she'd been using a diphenhydramine-containing product almost every night to help her breathe and sleep. Her doctor changed it. Within weeks, the fog began to lift. Her family described watching her come back to them, gradually but unmistakably. It was not the beginning of dementia. It was a pill they'd bought at a pharmacy without a second thought. Second and third generation antihistamines, loratadine, cetirizine, fexofenadine, are equally effective at managing allergies. They're designed not to cross into the brain, which means no sedation, no confusion, and no cardiovascular interference. If you manage allergies regularly, this is the straightforward switch worth making. If you're using an over-the-counter sleep aid, check the label for diphenhydramine. And if it's there, have the conversation with your doctor about a better long-term approach. The fifth pill, a blood pressure medication that works too fast. The fifth pill may surprise you more than any of the others because it belongs to a category people associate with protecting the heart. Certain short-acting calcium channel blockers, particularly immediate-release nifedipine, are still found in some older adults' medicine cabinets, sometimes as a rescue medication to be taken when blood pressure readings spike. This practice is considered dangerous by current medical standards, and yet I still see it. Here's why it's a problem. High blood pressure in an older adult is like a dam holding back pressure that has built up over time. The goal of treatment is to gradually open the gates, releasing pressure in a slow, controlled, sustainable way. Immediate-release nifedipine does the opposite. it causes a rapid, powerful drop in blood pressure. The arteries dilate suddenly, blood pressure falls steeply. An older cardiovascular system does not adapt well to sudden changes. That sharp drop causes dizziness and can trigger fainting, which means falls. And then comes the rebound. The body, sensing the sudden pressure drop, releases stress hormones to compensate. The heart rate surges. In an artery that already has some degree of narrowing, that sudden surge in demand can be the trigger for angina or a heart attack. Margaret was 74 and had been given immediate-release nifedipine by a well-meaning family member years earlier as something to take when the pressure goes up. She'd been using it intermittently for 3 years. When we reviewed her medication history and explained the risk, she was genuinely shaken. She'd believed she was protecting herself. Modern blood pressure management uses long-acting medications taken once daily that release slowly over 24 hours, maintaining steady, stable control without the dangerous peaks and valleys. If you find short-acting nifedipine capsules in your medicine cabinet, or if you've been told to take any blood pressure medication on an as-needed basis without clear medical guidance, bring it up with your doctor. Ask whether your current approach provides the steady, gentle control that your heart actually needs. Your action plan. How to have this conversation. Now, I want to give you something practical, because knowing all of this is only useful if you do something with it. Your goal is not to go home and throw pills away. Your goal is to walk into your next appointment prepared to have a real conversation. Before that appointment, collect everything you take: prescriptions, over-the-counter products, vitamins, supplements, drops, patches, everything. Put it in a bag and bring it with you. Doctors call this a brown bag review, and it is one of the most valuable things a patient can do. We cannot help you manage what we don't know you're taking. When you're in the appointment, frame this as a partnership, not a confrontation. You might say something like, "I'd like to take some time to review everything I'm taking together. I want to make sure that what's in my medicine cabinet is still the safest choice for me at this stage of my life." That opens a door without putting anyone on the defensive. Ask specific questions about each medication you're concerned about. Is this still the best option for my situation, or are there newer alternatives that might be safer for my heart? Are there any interactions between these medications I should know about? If I wanted to reduce my reliance on this, what would that process look like? You are the expert on how you feel. Your doctor is the expert on what the options are. That combination, when both people are engaged and honest, produces the best possible care. Harold, who I told you about at the beginning, went through exactly this process. Over several months, working carefully with his physicians, his medication list was reviewed and adjusted. 2 medications were changed to safer alternatives. One was phased out entirely with a non-pharmacological approach substituted. His dizziness resolved. His mental clarity returned. He went back to his card game. "I thought feeling that way was just getting older," he told me at a follow-up appointment. "Nobody told me it might be the pills. That is why I make these videos, because that conversation, the one that changes everything, doesn't always happen on its own. Sometimes it needs a starting point. Share this video with someone who needs it, a parent, a sibling, a friend who takes a handful of pills every morning and has never questioned whether all of them are still the right choice. You might be giving them the beginning of a conversation that genuinely changes their health. Leave a comment telling me which of these 5 medications surprised you most, or tell me if there's a medication you've been wondering about that I didn't cover today. Subscribe if you haven't already. I'm Dr. Jake Taylor. Take care of yourself, and I'll see you in the next video.